The handouts or review materials must be treated with utmost confidentiality. It shall be the responsibility of the person whose name appears therein that the handouts or review materials are not photocopied or in any way reproduced, shared, or lent to any person or disposed in any manner. Any handouts or review materials found in the possession of another person whose name does not appear therein shall be prima facie evidence of violation of RA 8293. Top-notch review materials are updated every 6 months based on the current trends and feedback. Please buy all recommended review books and other materials.
Now we go to my favorite part when studying the board exam, legal medicine. For some reason, ang saya niya aralin Nakakatawa siya aralin. So 81, according to the ethical code of the PMA, an MD shall waive his professional fee to the following people, except sa mga kapatid ng colleague mo. Sa colleague, dapat ilibre mo na yan sa kanyang asawa sa kanyang mga anak. Okay? Pati sa kanyang parents, actually. So, hindi kasama ang mga kapatid dyan ng iyong colleague. In reality, guys, of course, libre mo na, di ba? Colleague mo naman yan, di ba? Pero according to our manuscript, hindi sila nire-require ng ating PMA. So, this document is very important for the board exams. At least mabasa mo siya once or twice. Very helpful kasi may mga natatanong po from this document. Okay? 82. The dean of this college or institute granting medicine is always a member of the Board of Medical Education. It's no other than the UP College of Medicine kasi it's the research university of the Philippines. Take note guys iba ang ating Board of Medical Education to our next question, the Board of Medical Examiners. They're very the same but the same acronym. They're very different but the same acronym. Now, for this question, the President of the Philippines is the one that appoints the members of this BOME. How are they different? Ang ating medical education, ginagawa siya para siya yung magmamanage at gagawa ng ating medical curriculum in the Philippines. If there are needs for adjustment, siya ang magtatalaga niyan. While the medical examiner, ang goal nila ay gumawa ng exam sa atin para magkaroon tayo ng license for medicine. Okay? This medical education board is under the Department of Education, being headed by the Secretary of Education. While the BOME, the examiners are under the civil service, under PRC, at meron siyang member of the board na ine-elect ng mga members niya. Pero ang mga members na to ay ina-appoint ng President ng Pilipinas. Ang nangyari dyan, nagkasabit ng 12 names kay President, tapos sa September of every year, okay, doon nagkakaroon ng appointment ng new na mga members if kailangan na. Okay? Now, for our Medical Education Board, as mentioned, laging kasama ang Dean of UPCM. Pero pwede rin maging member ang ibang deans ng ibang colleges kapag sila ang naging representative ng Council of Deans of Philippine Medical Schools or kapag sila ang naging sugo ng APMC. 84. Okay, so this question was asked during my time, which is not a basic principle of the Belmont Report. It is autonomy. And this question is also important. What event triggered the creation of the Nuremberg Code? Okay, of the Nuremberg Code. It is your Nazi experimentation during World War II. So dito, you don't need to master the manuscript or the document, but you have to know their purpose. The Nuremberg Code parang halos pareho with the Helsinki Declaration. The Nuremberg focuses on human research, but the Helsinki Declaration focuses on both human research and clinical practice. Walang trigger event sa Helsinki pero ang Nuremberg Code ay dahil sa Nazi experimentation back in World War II sa mga Jews, sa mga Hudyo. The Belmont Report, as mentioned, has the following basic principles. At ang triggers niya ay yung mga poor experimentation na ginawa sa US, such as the Tuskegee syphilis study and the Willowbrook hepatitis study. So they are the triggers for the Belmont Report documentation. 86. According to our Medical Act, alin dyan ang hindi part ng ating admission requirements, hindi kailangan ng transcript ng interview. Hindi po kailangan ng interview for admission to a medical school, pero ginagawa siya ng mga medical school para masala yung mga best students or appropriate students for a medical school admission. Okay, ito yung mga kailangan na stuff. Okay lang po ang degree na arts. Okay, kailangan lang ng eligibility na certificate entrance sa medical school. Kailangan ng good moral character from at least 2 na former professor ng ating student at kailangan ng birth certificate. 87. According to our Medical Act, which is not part of the minimum required courses in the Doctor of Medicine program, hindi po kasama ang ating biostat and epidemiology. As mentioned in this section 6, no mention of biostat and epidemiology. Pero meron kang public health and preventive medicine. But the subject itself, walang binanggit. Guys, dito, word per word po ang tanungan. Pag ang usapan ay mga laws. Okay? So, kung anong sinabi, yun na yun. Pag hindi binanggit, hindi siya binanggit. Okay? Take note of that. And please, at least read your Medical Act of 1959 kasi yan ang ating bread and butter as medical doctors in the Philippines. 88. Now, according to the rules of court, what is the most important feature of an evidence for it to be admissible in the court? Kailangan siya ay relevant to the issue. Of course, it makes sense kasi walang point ang evidence kung hindi naman siya related sa ating dilemma or issue. Kahit na valid siya, kahit tangible siya, kahit provide siya ng isang expert witness, pero wala siyang relevance to the issue, hindi siya magiging admissible to the court. So this is the most important feature needed for an evidence to be admissible to the court. 89. According to our Medical Act, which statement is a qualification of a medical examiner. Dapat ikaw ay isang natural-born citizen. Bawal ang mga naturalized citizen para maging examiner. Kailangan ikaw ay isang MD na registered sa Pilipinas. Kailangan naka 10 years ka na na-practice. At kailangan ay ikaw ay hindi member ng any faculty or any training institution during your time of appointment. So, yan ang mga important na qualifications. Besides sa mga nabanggit ko, kailangan meron kang good moral character and good standing sa PMA. 90. According again to our Medical Act, medical students who have completed at least 4 years of MD degree may help during national emergencies. So, kailangan mo ng at least 4 years, kailangan nakapag at least clerkship ka na or at least exposure to the clinics bago ka pwede payagan tumulong sa mga epidemics kapag naubusan na ng available na doktor. Okay? Andiyan yan sa ating Section 12. Now, for some forensic medicine, the basis is really Pedro Solis. Okay? It's an outdated resource, pero it's still being used right now. So, take note of these concepts, and kung may mga inconsistency and socially unacceptable concepts, tanggapin nyo na lang muna for now. Kasi it is the basis of our exam for LegMed and forensic medicine. Like for this question, an idiot has an IQ level of 0 to 20. Kahit na alam natin na IQ is not useful for determining intelligence. Okay? It's a very poor means for detecting intelligence. Okay? So you have to memorize at least this one. Okay? I've just included this kasi meron din pala for intelligence. Okay? Kung hindi lang sa bobo, meron din for intelligence. Okay? So, take note of these concepts. Natatanong po sila for the board exams. 92. Okay? Guys, this is forensic medicine. Iba ang usapan sa OB. A dead body of a woman was identified at a crime scene. The fundus of the uterus is 3 fingers above the umbilicus. What is the estimated age of the fetus? It is 7 months. Now dito, my point of reference is 6 calendar months for the umbilicus. Tapos, magba-vary lang yan every 3 fingers. Iba kapag 3 fingers above, okay, 6 fingers above, okay. So take note of this reference point. That is how I memorize this table from Solis. 93. Again guys, iba-iba tayo ng basis, pero dapat sundan muna natin for now ang ating Solis. Okay. So according to Pedro Solis, if meron ka ng more than half na laceration ng hymen at nag-go beyond siya sa ating vaginal wall, ang tawag sa hymen na laceration ay compound already. It makes sense kasi beyond the vaginal wall ka na. Therefore, compound na, hindi lang vaginal, hindi lang hymen ang involve. Okay, more than the hymen, mayroon pang ibang involved structure. Tumagos ka na. So, compound siya or complicated na hymen na laceration. If less than 1/2 the width of the hymen, superficial lang siya. If more than 1/2 of the width of the hymen but not reaching the base, deep lang siya. Pero kapag umabot na ng base ng hymen, complete hymenal laceration ang tawag dyan. Okay, going back to our code of ethics, okay, which is not a duty of MDs to their patients. All are correct except for number 1. Kasi guys, an MD should always first and foremost ensure his safety all the time. Kaya mali yung natin kasi sabi dito, even if there is a risk, kailangan mong tumulong. No. If there's a risk for your life, okay, pwede kang hindi tumulong. Okay? You don't have to be a hero per our ethical code. Okay? Kasi nga, baka masacrifice yung life mo in the process. Actually, kung isipin mo, ethically wise, tama siya. Kasi what if madali ka sa accident, magka-problema sa'yo. Tapos yung safety mo, ang nangyari, instead na isang tao lang dapat ng biktima, tuna ang victim sa crime scene or sa incident. So you are actually adding to the problem if it will only increase your risk for safety. So hinay-hinay lang guys when helping out. Make sure you're always safe first and foremost. We need you as future MDs. Okay? 95, this is still under your Solis, which phobia is defined as being afraid from religious or sacred things. It's your hierophobia. Belanophobia, sharp objects yan. Heliophobia from the sun. And dendrophobia is phobia from trees. Okay, this is the list of phobias from Solis. 96, among the choices, which is the most practical, useful, and reliable way to preserve evidence, is no other than photography. Of course, it's a picture. Okay? Ang sketching, baka mali ang sketching, ang drawing, baka pangit ang drawing. Description in the words, baka mali-mali pa rin ang pag-describe. Still subjective, di ba? And of course, preservation in the mind of the witness. The mind is very gullible. Okay? Madaling mabago yan. Pwede mong i-fake yan in the process. So still, the most objective and reliable is your photography. Above all. 97. According to Pedro Solis, this refers to an abnormal condition wherein a patient is performing an act while in a state of natural sleep. It's known as somnambulism. Okay? Ang semi-somnolence or somnolentia, ang sinabi niya is it's as half sleep state siya, kumbaga. Para siyang half sleep state. Okay? Ito, tulog ka talaga. You're in a natural state of sleep. Pag hypnotism or mesmerism, ikaw ay hypnotized. Pag delirium, it's a state of confusion of the mind, having hallucinations, illusions, delusions, etc. 98, talking about mania, kapag an impulse against maiming of animals, okay, it's known as mythilomania. Pyromania for fire, kleptomania pag nanakaw, dipsomania to indulge in alcohol or drug intoxication, homicidal to commit homicide, sex impulse to commit sexual perversion, and suicide to terminate one's life. Okay? These are disorders of compulsion. 99, kung ang President ng Pilipinas ang may kayang mag-appoint, siya rin yung may kayang magtanggal as long as na-recommend siya ng Commissioner of Civil Service. Pero pwede nilang tanggalin ito kapag meron kang neglect of duty, incompetency, and unprofessional conduct. Overstaying is not a criterion for removal from the Board of Medical Examiners. So 2 and 3 lang ang tamang sagot dyan. If you have the following. Hindi kasama ang ating overstaying. And lastly, possession of this amount of marijuana resin oil is an indication for life imprisonment to death and a fine ranging from 500,000 to 10 million pesos. It is around 10 grams or more. So, pag 50 grams or more, it's only applicable to shabu or methamphetamine. Pag marijuana na usual marijuana, kailangan 500 grams or more. Pero for everything else, for all kinds of drugs, including marijuana resin and resin oil, at least 10 grams enough na para magkaroon ka ng lifelong imprisonment, saka fine ranging to up to 10 million pesos. That's all for your legal medicine. Now we go to pathology. 101. Okay? TNF, IL-1, and IL-6 are inflammatory mediators causing acute phase reaction upregulation. Which of the following substances is downregulated during a state of acute phase reaction? Or during inflammation? Yun ang point niyan. Lahat tumataas except for albumin. So albumin, bumababa siya along with transferrin, prealbumin, RBP, and antithrombin. They are collectively known as negative acute phase reactants, meaning their levels go down during states of inflammation. Kaya guys, ipapansin ninyo in the wards, patients with infection and inflammation, they have lower albumin even if okay ang kanilang liver. Kasi albumin is a negative acute phase reactant. Now, the source of your acute phase reactants are generally from the liver. And take note, sabi ni Robbins, your IL-6 mainly produce CRP, while your IL-1 and TNF mainly secrete your serum amyloid A. Now, for your positive acute phase reactants, I have this mnemonic na there are more fish in the sea. Ferritin, fibrinogen, SAA, hepcidin, siya kasi reactive protein. Now, bakit sila tumataas during inflammation? One is ferritin kasi ferritin, okay, mainly apoferritin sequesters iron. Gusto mong itago ang iron away from the blood kasi during states of inflammation, kahit na wala kang infection, ang isipin ng katawan mo iba ka meron kang foreign na microorganism. And take note that microbes, mainly bacteria, loves iron. They love iron, so we have to remove iron from the blood. Kasi iron will cause increase in bacterial growth. So ferritin must be increased to sequester iron. Fibrinogen is increased kasi during states of inflammation, pwede ma-damage ang iyong endothelium. So, kailangan mo ng fibrinogen para ma-repair ito. And an increase in fibrinogen will lead to an increase in ESR. Siya ang nakikita dito. Siya ang indirect na measurement of fibrinogen increase. SAA is increase and lots of SAA can even lead to amyloidosis, especially in states of auto-inflammatory conditions. Yung mga states like your familial Mediterranean fever, okay, kung saan meron kang increased activity of IL-1 and TNF. Okay, so sobrang daming SAA mo sa katawan, they can lead to amyloidosis. Hepcidin is important for iron control. So, ang ginagawa ng hepcidin mo ay it decreases iron absorption and release from stores. Same banana, gusto mong itago ang iron away from the blood para hindi magkaroon ng increase in bacterial growth. And lastly, C-reactive protein is a powerful opsonizing agent. Dok, ano ang ating opsonization? Pinapayummy niya yung mga bacteria. Yummy. Okay? Para sila ay kainin ng ating mga phagocytes. Okay? The more na opsonize ang ating mga bacteria, the more na magiging active ang ating mga phagocytes, mga neutrophils, mga macrophages natin. Hence, all of them are required to be increased during states of inflammation. These are acute phase reactants. 102, okay, you have a patient na nagkaroon ng wound during a Spartan race event. Pero after 2 weeks, biglang nag-decrease ang kanyang gap. This is because of your myofibroblasts capable of your wound contraction. So these are the 3 important events in wound healing. The first is to deposit connective tissue. During the early stage of repair, ang major na tissue dyan ay collagen type 3 or reticulin fibers. This is actually a very weak form of collagen. Okay, so ang nagbibigay dyan ay TGF-beta. Tapos, along the way, okay, there's wound contraction as well para mas malimit ang gap natin. So, it's being mediated by your myofibroblasts, and from the name itself, guys, myofibroblasts, meron of myo. Meron siya mga actin filaments allowing the contraction of the wound gap. And lastly, you have to have remodeling. As mentioned, di ba, collagen type 3 is very weak. You have to remodel them eventually into the stronger collagen type 1, seen in the late phase of your wound healing. So this is being managed by your metalloproteinases. And these proteinases are being activated by your zinc. So zinc is important as well in wound healing besides your vitamin C. So kailangan siya for wound healing as well. 103. You have a 3-year-old female having poor intelligence, having laughter paroxysms, absent speech, and jerky movements. Para kang happy puppet. Okay? This is your happy puppet syndrome, also known as your angel man syndrome, a disorder of your chromosome 15. So, it's a form of genetic imprinting problem. Okay? So, there are 2 types, Prader-Willi and your Angelman syndrome. Both of them are involved in chromosome 15. Both of them can have mental retardation. Pero, si Prader-Willi, sa kanya, you have hypogonadism and obesity due to hyperphagia. Ang isa pang difference nila ay, si Angelman, meron kang deletion ng iyong maternal gene. Angelman for the maternal, Prader sounds like father. So, meron ka dyan deletion ng paternal gene. Siya ang nawawala. So, guys, Prader has no dad, and MDs are angel. A good mnemonic for genetic imprinting disorders. 104, which antibody has the highest concentration in the serum? It's your IgG. Okay? So, GAMDE. IgG has the highest concentration in the serum. Pero pag ang usapan ay overall in the body, it's your IgA. Since IgA is highly secreted sa ating mga mucosal surfaces in the mouth, in the genitourinary tract, and in our respiratory tracts. So overall, siya yung merong most produced overall sa katawan natin. Napag-usapan naman ng complement activation, both IgM and IgG can activate the complement system. But only IgG can pass through the placenta. IgE can increase in helmintic infection and is also responsible for mast cell activation. Pag ang usapan naman ay mga naive B cells, ito yung mga B cells na hindi pa na presenta ng antigen from the APCs, they only have IgM and IgD. Moreover, IgD has a known immunomodulatory effect. Pag ang usapan naman ay immune response, we have 2 types, the primary response and the secondary response. Ang point niyan, in a primary response, the first interaction with the microbe, mostly IgM ang ating napoproduce muna. Ay, sorry guys, take note of this correction in the handout, okay? IgM muna dapat to. Okay? Tapos, ang ating secondary immune response ay IgG na. Okay, please take note if di na bago sa handout nyo, IgM and IgG dapat yan. Okay? So for the primary immune response, guys, it should be IgM. IgM. Tapos, pag secondary immune response na, kapag second encounter mo na with the same organism, mas mataas ang response, mas faster siya. Tapos mainly, IgG na yung binubuo mo na antibodies dito. Okay? Take note of these important concepts in antibody response. 105. What is the most reliable feature differentiating your malignancy from benign tumors? It's of course your metastases. Okay, all of these are features of your malignant tumors. Pero pinaka-consistent is your metastases. Kasi alam mong kumalat na ang ating tumor, a very strong feature of your malignant tumors. Okay? So, ang ating tumor na malignant is usually locally infiltrating and usually stem-like siya. It has anaplasia. Okay? And very rapid din kanyang erratic yung kanyang growth. Pero the most defining feature of malignancy is, of course, having metastatic lesions in different parts of the body. 106. The guardian angel against obesity is your adiponectin, according to your Robbins and Cotran. So, some important mechanisms of obesity. Adiponectin kasi, it directly stimulates beta-oxygen. So, it decreases fatty acids, so mas papayat ka in the process. Leptin can cause anorexia, busog. Pero ghrelin can cause gutom. Mas gutom ka if you have ghrelin increase. Furthermore, peptin YY and amylin can also cause anorexia in the process. 107. People in Quezon County has cardiomyopathy. This is known as your Quezon cardiomyopathy. And this condition is seen in decreased levels of selenium in the soil of water of that county in China. So, siya ang naging cause ng term having your Quezon cardiomyopathy. Okay, some trace elements in important deficiency syndromes. Fluoride decrease can cause dental caries. Zinc, okay, seen in acrodermatitis enteropathica. Iodine, hypothyroidism. Iron can cause your microcytic hypochromic anemia, and copper can lead to your Menkes disease, having abnormal cross-linking, muscle weakness, and mental retardation. As mentioned, it is very important for your lysyl oxidase enzyme for the cross-linking of your tropocollagen to form your mature collagen fibers. 108. The leading cause of death in children aged 1 to 4 are accidents. Okay? And consistent siya from 1 to 14 years old. Actually, even up to adulthood. Sabi ni Schwartz, ages 1 to 44, ang most common cause of death or mortality ay still accidents, according to Schwartz. Okay? Pero pag first 12 months of life, the most common cause of death sa mga bata ay congenital anomalies. 109. Okay, so let's go to the histology of some pathologies. Very important in patho, ha? You should know their hallmarks. Having status kay pattern is specific to your Burkitt lymphoma. Okay? Ang ating mycosis fungoides, yan yung ating mga Potrier microabscesses. Hodgkin lymphoma, your Reed-Sternberg. And your Langerhans, as mentioned before, are your Birbeck granules. So here is the list of your hallmarks of some important hematological conditions. Our rods, AML, smudge or basket cells for the CLL, and your dacrocytes and leukoerythroblastosis for your primary myelofibrosis. Now, which condition is not a risk factor for developing esophageal adenocarcinoma? So, let's see the pathophysiology per condition. Guys, tobacco use, smoking can increase risk for cancer in general. So, it is a risk factor. Check. In obesity, sobrang lumalaki yung tiyan mo. Because of it, ang nangyayari, nababanat yung ating lower esophageal valve. Okay? So, nagkakaroon ka ng decrease in pressure of your lower esophageal sphincter. When that happens, reflux is very prominent. So, ang nangyayari, there's actually hydrochloric acid that can destroy the mucosa of your lower esophagus, posing a risk for adenocarcinoma formation. Same with your chronic GERD disease. Pero, not a risk factor ng ating H. pylori infection. Bakit? Kasi in H. pylori, actually ginagawa niya, it destroys the gastrin secreting cells found mostly sa antrum ng ating stomach. Therefore, leading to low levels of HCl. Therefore, if you have low levels of HCl, hindi siya very acidic. Therefore, hindi siya damaging kapag nag-reflux sa ating esophagus. Therefore, H. pylori infection is not a risk factor. It's a protective factor for esophageal adenocarcinoma. Pero guys hindi ibig sabihin na kailangan mo magpa-infect ng H. pylori kasi pag may H. pylori ka, at risk ka for gastric maltoma and gastric adenocarcinoma naman. Okay? 111. Which statement best describes the pathophysiology of Graves' disease? It's a type of hypersensitivity reaction. Type 2, it's an antibody mediated. It's also an autoimmune process. So ginagawa niya, it causes hyperfunctioning of the thyroid, leading to your hyperthyroid symptoms. So B is the correct answer here. So here are the types of type 2 reactions. But before that, we also have type 1. Pag type 1, ito yung IgE mediated. Okay? Type 2 is antibody mediated, mainly by your IgG and your IgM. Ang type 3 ay immune complex mediated. Okay? An interaction of your antigen-antibody complexes. While type 4 naman is T-cell mediated. Under type 2, may mga type siya of pathophysiology. They can destroy cells, can cause inflammation, and even cause dysfunctioning. Pwede ka mag-hyperfunction ng thyroid like in Graves, or in myasthenia gravis can cause hypofunctioning. 112. Oncogenes can be formed by translocations. Ang translocation ng chromosomes involved in Burkitt lymphoma is your T814. Okay, so here naman is the list of your chromosomal translocations for your review. 113. What agent, can cause megaloblastic anemia? But first, ano ba itong mga tapeworms na yan? These are their common names, but these are their scientific names. Fish tapeworm is your dilatum, beef tapeworm is your T. saginata, dog tapeworm is your Dipylidium caninum, and dwarf tapeworm is your H. nana. So guys, hindi lang enough na alam mo yung kanilang scientific name. You also have to know their common or general names. Among them, fish tapeworm can cause megaloblastic anemia because this parasite competes with your body in absorption of your vitamin B12. Normally, the B12 along with the intrinsic factor is absorbed at the terminal ileum. But this parasite, ginagawa niya, inaagawan yung katawan natin ng B12. Therefore, you will have B12 deficiency leading to megaloblastic anemia. 114, which statement is not included in the rules of 2. Okay, tama ang A. It occurs in approximately 2% of the population. Tama ang B. It's within 2 feet, Guys, within 2 feet. Dito sa Michael Diverticular rules of 2, okay, ang ginagamit dyan ay English measurements. Feet, inches, approximately 2 inches long, So, not centimeter, hindi siya naka-meter. It's feet and inches. And lastly, mali ang D kasi dapat twice more common siya in males. So, here is the Michael Diverticulum rules of 2. Tapos, ang kulang doon ay dapat usually symptomatic ka at age 2. It's only a trend, and this is actually mentioned also in Robbins and Cotran. So, you should master these rules of 2. Okay? So, Michael, it's the most common true diverticulum and the most common congenital anomaly of the GI tract. Ang most common site niya ay sa ileum. Pero, yung part ng ileum na walang mesentery. Kung mesentery to, doon siya sa part na walang mesentery. The anti-mesenteric side. Tapos, usually, meron diyang heterotopic mucosa. A heterotopic tissue is a tissue na dapat wala doon. So, in this case, usually meron diyang gastric mucosa. Yan yung pinaka-common na heterotopic mucosa sa ating Michael Diverticulum. Dahil meron diyang gastric mucosa, this mucosa is actually sensitive to hormones increasing gastric secretion, like gastrin for example. Therefore, kapag nagkaroon ka ng increasing gastrin, pwede ka magkaroon ng increase dyan ng HCl production. And when that happens, it can damage the ileum and can cause bleeding. So, it can cause bleed in Meckel diverticulum. So, ingat guys dito. 115, what is the most important pathologic feature of acute appendicitis? According to Robbins, it's the A, having neutrophils, guys, to be specific, at the muscularis propria. Now, bakit ba nagkakaroon ng appendicitis? It occurs when you have luminal obstruction, most importantly. So, nangyari dyan, sa appendix mo, nagkaroon ng obstruction sa lumen mo. When that happens, nagkakaroon ng build up dito ng pressure. Okay? Kasi yung mga secretion mo naiipon. They're not going to the lumen of the colon, of the cecum. When build up happens here, pressure increases. Ang nangyayari, yung venous flow dyan sa kanyang gut wall, naiipit. Pag naiipit siya, nagkakaroon ka ng inflammation. That causes appendicitis. And per epidemiology, in some studies, ang most common cause daw sa children ay lymphoid hyperplasia, usually occurring after a viral infection. Pag mga adults naman, usually meron daw dyang fecalit. Fecalit is a fecal matter na parang namuong, parang like a stone, na nagbibuild up dito, na statak dyan, kaya nangyayari, nagkakaroon ka ng build up of pressure. Okay? So, yan ang mga salient features of acute appendicitis. 116, either female having flank pain and gross hematuria. Okay, these are signs of a possible stone. And tama nga, sa imaging may nakita ang staghorn calculi, kung saan inoccupy niya ang renal calyces. Ang tanong, what is the agent mostly associated with this condition? Is her Proteus mirabilis? Doc, bakit? Take note that struvite stones are the components of her staghorn calculi, and they're rich in ammonium magnesium phosphate. Ammonium can be derived from urea. If there is the presence of urease, urease can transform your urea into ammonium ions. And urease can be found in Proteus mirabilis. It's one of its prominent enzymes. So, Proteus mirabilis, especially the recurrent UTI, can cause staghorn calculi formation. 117, what histologic part of the prostate serves as the most common site for prostatic adenocarcinoma development? Okay, it's your peripheral zone. Now, your prostate has several distinct regions: a central zone, peripheral zone, transitional zone, and the periurethral zone. Okay? It's important to take note that most hyperplasias occur at the transition zone. Okay? The one enveloping the urethra. Kaya, usually, if you have BPH, you have symptoms of obstruction, urinary obstruction. Okay? Now, in contrast, the peripheral zone, okay, nasa pinakalabas siya ng ating prostate. It's the most common site of your adenocarcinoma. Kaya, if you have adenocarcinoma, cancer of the prostate, usually, hindi nauuna ang ating obstructive symptoms. Late na siya kapag very large na yung ating mass. Kasi nga, it starts at the peripheral zone. Malayo ng konti sa ating urethra. Pero okay na rin siya kasi malapit siya sa rectum. Therefore, kaya siya makapa during DRE. So, yun na rin yung parang benefit nun. Kaya useful screening ang DRE for prostatic adenocarcinoma. 118. You have a female having a left adnexal mass. Check. May mass ka sa ovaries, probably. And you have effusion tsaka ascites. This is a syndrome known as your Meigs syndrome. And this is associated with the ovarian tumor known as fibroma. Fibromas are prone for having Meigs syndrome. Although rare lang naman to. Okay, but very testable in the board exams. Fibroma, pleural effusion or or hydrothorax, and ascites. Now, these are other important clinical conditions. In granulosa cell tumor, take note that granulosa cells produce your estrogen. And high amounts of estrogen can cause postmenopausal bleeding kasi nagkakaroon ka pa ng thickening of the endometrium. Take note that estrogen causes proliferation of the endometrium. So, pag may mga symptoms ka na ganyan, after menopause, then you're considering an ovarian mass, baka meron kang granulosa cell tumor. Okay? Now, next, Sertoli Leydig cell tumor. They produce here, largely, testosterone. So, kapag ang pasyente mo, merong ovarian mass, tapos merong kang hirsutism, male pattern baldness, clitoral enlargement, baka ang nature ng kanyang mass ay Sertoli Leydig cell tumor. Hence, you have to know this concept. 119. A 22-year-old male have a mass sa kanyang epiphysis, take note, epiphysis. And you have here soap bubble appearance. What is the most likely condition of this patient? Now, in identifying bone neoplasms, first, kailangan mo malaman yung kanyang location. Saan part siya ng bone natin? In this case, epiphysis siya. Pangalawa, what is its radiographic appearance? In this case, it is found sa ating long bone, tapos siya ay merong soap bubble. This is known as your giant cell tumor. Although nakakatakot, it's still a benign tumor. Okay, so that's the rationale, guys. You have to know the location first. If sa metaphysis ba siya, iba yan. If diaphysis ba siya, iba siya. And iba rin kapag siya ay nasa axial skeleton. Tapos, you then ask their radiographic signs. Soap bubble pag giant cell, sunburst pattern and Codman triangle for osteosarcoma, gray-white translucent cartilage for the chondrosarcoma, and onion skin reaction for Ewing sarcoma. Last but not the least, for CNS tumors, a newborn was noted to have herniation of both cerebellar vermis and tonsils, causing aqueductal stenosis, causing hydrocephalus. What is this condition? This is known as Chiari-2 malformation. Okay, kasi meron kang two structures na nag-herniate. Pag only tonsils ang involved, tonsils, the first one, tonsils, Chiari-1 lang yan. Pero pag tonsils ang vermis na ang involved sa ating herniation through the foramen magnum, ang tawag dyan ay Chiari-2 malformation na. In Dandy Walker, wala kang herniation, pero meron kang agenesis of your vermis. So with that said, lilit ang cerebellum mo, magkakaroon ka ng enlargement naman ng iyong fourth ventricle. Okay? So yun ang ating Dandy Walker malformation. Now what you have to know here is their associated conditions. Chiari-1, syringomyelia, Chiari-2, myelomeningocele, and Dandy Walker naman, spina bifida. And that's all for your pathology. Now, let's go to pharmacology. Okay, guys, ang pharmacology for me, it is best studied along with the clinical sciences. Okay, when you study IM, study pharma along the way. When you're studying systemic pharma, kasi para alam yung binibigay sa pasyente mo, when you study microbes, study antibiotics and antimicrobials, para mas madali siyang tandaan. I think that's my best tip here for pharmacology. Okay, let's go to 121. What drug, okay, is associated with cardiotoxicity? It's your trastuzumab. Guys, follow your chemo man, okay? So guys, ito, madaling matandaan to guys with the chemo man. Besides trastuzumab, also doxorubicin, forming the heart of the patient of the chemo man, can cause cardiac problems, can cause cardiomyopathy, okay? Cisplatin, carboplatin, and can cause both ototoxicity and nephrotoxicity. The lungs or bleomycin busulfan can cause fibrosis. Vincristine can cause neuropathy of the peripheral extremities. And your cyclophosphamide, of course, can cause hemorrhagic cystitis. 122. What drug is most effective in managing malignant hyperthermia? So, malignant hyperthermia occurs usually in some patients na may genetic problem with your ryanodine receptors. These receptors are the ones that release calcium coming from the sarcoplasmic reticulum of your skeletal muscles. So if you have large amounts of calcium inside your skeletal muscle, what happens is you have muscle contraction. Tama? Now, when those patients with genetic problems with RYR, okay, when you are exposed to anesthetics, okay, pwede kang magkaroon ng unstoppable na release of calcium from the SR or sarcoplasmic reticulum. Hindi sila nababalik paloob. Therefore, retention of calcium inside the muscles can cause overall muscle contraction. And as you all know, pag nag-contract ang muscles mo, like in chills, you can have fever, you can have high levels of temperature. Kaya siya malignant hyperthermia. No, kailangan mo ng drug na kayang mag-counteract yung release ng calcium from this receptor, from your RYR, and that is your dantrolene. That's the function of this drug. 1, 2, 3. What antithyroid agent can be given for 2 weeks to reduce the likelihood of thyroid storm during surgery of the thyroid and can even reduce thyroid gland vascularity? That is your Lugol solution. The Lugol solution contains iodine. And how does this work? Because iodine can cause your Wolff-Chaikoff effect, known as your iodine-induced hypothyroidism. So basically, binababa niya yung ating levels of thyroid in the blood para hindi siya super mag-cause ng thyroid storm during surgery. Kasi high amounts of thyroid hormones in a patient with thyroid problems, especially hyperthyroidism, pwede mag-cause ng thyroid storm yan. Kasi surgery is a stressor event for the body. Okay? Now, here are some of your MOAs for different antithyroid agents. Both metimazole and PTU are TPO inhibitors. Pero, ang propylthiouracil ay merong decrease in peripheral conversion ng T4 to T3. Kasi T3 is the most active form of your thyroid hormone. Propranolol is also good kasi it's a beta blocker, decreasing the sympathetic effects of thyrotoxicosis, but it can also prevent conversion of T4 to T3. Now, how do you use this in medicine? So, usually guys, kapag meron kang thyroid storm, you give propylthiouracil. Bakit? Kasi, mas preferred siya than metimazole kasi meron tong kasama na decrease in conversion of T4 to T3. Kasi ayaw mo nga ma-activate ang T3 masyado. So, binibigay mo yan. At binibigay mo rin si propranolol in the process. Moreover, it can also give Lugol solution during states of thyroid storm. However, between the two, kapag normal population tayo, kapag hindi tayo in storm, pero meron akong hyperthyroid symptoms, mas binibigay ang metimazole. Kasi ang PTU ay merong high risk for liver toxicity. Pero pag ang usapan naman ay buntis, nagbabago tayo. Pag pregnant women, mas maganda ang ating PTU. Kasi metimazole is actually associated with aplasia cutis. So kapag mga first trimester ka, mas binibigay ang PTU for the pregnant woman. Kasi nga, ayaw mo magkaroon ng teratogenic effects from metimazole. Okay? So that is the rationale behind your antithyroid agents. 1, 2, 4. What is the primary drug for fascioliasis? Okay? Fascioliasis is being caused by your fasciola, your liver flux. It's your triclabendazole. Please don't be confused between fasciolopsis and fasciola. Fasciolopsis is an intestinal trematode or fluke, while fasciola is a liver fluke. Now, your trematode infections, all of them, in general, can be treated with praziquantel. But the best drug for fasciola is always triclabendazole. 1, 2, 5. A newborn from a mother with poor OB follow-up has yellow teeth discoloration and poor fetal long bone growth. Ano ang drug kaya na pwede mag-cause ng ganyan sa ating patient? This is your tetracyclines. So guys, in pharmacology, take note of the adverse effects of the drugs and teratogenic effects if possible. So they're very testable in OB and in pharmacology. And even in pedia as well. So when you give teratogens to the patient, as much as possible, iwas sa first trimester because that first 3 to 8 weeks of AOG, yung time na yan, 3 to 8 weeks of AOG, you are very prone for teratogenesis because it is the time for organogenesis, the time when the organs of the fetus are being differentiated into different systems. So, if there's an insult during that time, magkakaroon ka ng permanent damage to your newborn baby. So, ingat tayo for teratogens. That is why you must know them para in practice in the future, hindi tayo magkamali. Okay? And I listed here the different teratogenic drugs and their common conditions, okay, for your memorization. 126, what is the first-line drug used for the treatment of your TDP? Is your magnesium sulfate. TDP occurs when there is actually QT prolongation. So, in patients with QT prolongation, ingat ka na guys sa magbigay ng mga following drugs. Most of them are antibiotics. So bago ka mabigay ng antibiotic guys, first check mo muna yung kanyang QT interval corrected. Baka kasi it's already prolonged. If prolonged na siya, iwas tayo dito. Lalo na sa mga taong merong cardiac problem and in the elderly because they're very prone for having ventricular arrhythmias. And one of them is your TDP, a form of polymorphic ventricular tachycardia. Besides antibiotics, ketoconazole, some antipsychotics, cocaine, and chloroquines can also cause QT prolongation. And the first-line drug here is your IV magnesium sulfate. 127, which drug is an endothelin receptor antagonist used for pulmonary hypertension treatment? So guys, in pharma, list all the drug classes and their examples. Usually, ganyan ang tanong sa exam. Very straightforward, very simple, very recall ang dating. So, among the following, bosentan is an endothelin receptor antagonist. Okay, yung mga may N, bosentan, ambresentan, may mga N sa gitna, those are endothelin antagonists. Okay, may mga prost, those are prostacyclin analogs, epoprostenol, iloprost. Okay, so look for trends and names in their drug names. May mga names dyan, guys. May mga trends dyan. So, that is how you memorize the drugs. So don't be worried. Kaya, guys, may mga ways for memorizing. There are mnemonics along the way in Top Notch and beyond. Okay? And of course, denafil is a PDEF inhibitor. 128. Okay, minsan naman, you must know naman their MOAs naman. Ito ay made here a K-type question, okay? Kasi para masanay ka, di magulat sa board exams. Because sometimes, this can be asked in the PLE, in this kind of format. So, which pair of anti-asthma drug and MOA are correctly matched? Actually, all are correct. Xylitol is a 5-lipoxygenase pathway inhibitor. Benralizumab is an IL-5 receptor antagonist. And your very famous omalizumab is an anti-EGE monoclonal therapeutic drug. So here's the list of our novel anti-asthma drugs. Okay? Yung ating mga anti-leukotrienes have LEU. Pero magkakaiba lang sila sa some terms. Pag LEU talaga, LEU, it's a lipoxygenase inhibitor. Pag LU, it's a leukotriene receptor inhibitor. As mentioned guys, your leukotrienes C4, D4, and E4 are very prominent, okay, that can cause bronchospasm. So, they're very helpful. Omalizumab, anti-IgE. Matik na yan, okay? Now, for theophylline naman, it's a methylxanthine. Ang ginagawa niya, it actually inhibits your phosphodiesterase. Normally kasi, this enzyme degrades your cyclic AMP. So, ang nangyayari, cyclic AMP then increases if you have inhibition of your phosphodiesterase. And take note that ang CAMP and calcium ions are always inversely related. An increase in CAMP will always cause a decrease in calcium ions and vice versa. So nangyayari, If you have more CAMP in the cell, you have less calcium ions inside the cell. Therefore, hindi magko-constrict yung mga muscles mo sa iyong respiratory tract, causing bronchodilation in the process. So that's the pathway or the MOA for theophylline. Hormones naman can cause prevention of mast cell degranulation. Now, very recent drugs naman also modify your interleukin 5 kasi it's a very important interleukin for asthma. So there are two types. One, counters directly your interleukin 5. Yung isa naman, it blocks the receptor. So dito guys, benralizumab counteracts the receptor itself. While your mepolizumab and reslizumab, they counter the interleukin 5 itself. If these drugs won't be as in pharma, they may be as in IM. So 129, which drug used for acid suppression is capable of decreasing your CAMP intracellularly for the parietal cell? The correct answer here is famotidine. So paano ba siya nangyayari? Because take a look of this figure. Famotidine is a histamine blocker. Okay? So, nangyari dyan guys, normally, your H2 receptor, when activated, ang nangyayari, it can cause an increase in CAMP. An increase in CAMP can lead to the activation of your HK ATPase, causing increase in HCl. Now, what if ang mangyari, nabigay ka ng H2 blocker, such as your famotidine? Ang mangyari, hindi gagana ang histamine sa ating H2 receptor. Therefore, CAMP will decrease in the process. And when CAMP is decreased, magkakaroon ka ng poor functioning of your HK ATPase, leading to low levels of HCl, thus suppressing your acid. Okay? Now, your esomeprazole and pantoprazole, they're PPIs, and they directly affect your HK ATPase. They're not involved with any G receptors. Ang atropine mo naman is involved in a different receptor, in a GQ receptor. It's only involved in your IP calcium, kaya wala siyang involvement with your H2 receptor. Hence, the answer is famotidine. 130. Which drug is a depolarizing NMB? It's your succinylcholine. So, it's a very unique drug dito kasi the rest are actually non-depolarizing NMBs. Siya lang yung pinaka-salient and important na depolarizing na NMB. So, these are anesthetic drugs. So, again guys, make a table out of them para madali mo sila mag-group in your mind when you see them afterwards. That's my best tip here. 131. The advantage of this drug is that it directly lowers only the heart rate without affecting the blood pressure of the patient when used. That is your ivabradine. Okay, kasi it's a funny current inhibitor. It only manages to decrease the heart rate. So maganda siya sa mga tao na merong recent na heart attack. After MI, ang goal mo ay to decrease the blood pressure, to decrease the heart rate to around 50 to 60 beats per minute. Pero usually in some patients na binigyan mo ng beta blocker, pwedeng hindi siya ma-reach. So pag hindi gumana yan, you may add ivabradine para umabot ng 50 to 60 without worrying hypotension. Ivabradine can also be used in patients with MI na medyo nasa low side of blood pressure, like around 100. If kinakabahan ka na magbigay ng added na beta blocker sa kanya para hindi siya mag-hypotension, you may use ivabradine kasi it only affects the heart rate of the patient. It is usually indicated when the heart rate is more than 70 after MI. Okay? This is also being used for heart failure patients with reduced ejection fraction. Okay, pag more than 70 rin yung kanilang heart rate, you also give ivabradine para bumaba siya to less than 70, around 50 to 60 sana. So, the MOA of the other drugs, metoprolol, a beta blocker, can cause both decrease in heart rate and also decrease in blood pressure. Okay, so if hindi siya enough, you add ivabradine as mentioned. Verapamil is a CCB, and nitroglycerin is a vasodilator. 132. What is the most common form of color blindness in ethambutol-toxicity? It's a red-green color blindness. 133. This antilmintric drug can kill parasites via increase in chloride influx to immobilize them. Because chloride can cause here hyperpolarization of your of the eukaryotic cells of your helminths. It's your ivermectin. Because ivermectin causes GABA neurotransmission increase, causing Cl influx. So guys, ganito yan. Don't forget also the target drugs of anti-limited drugs and their MOAs. Kasi iba-iba pa rin sila. Like for albendazole, it causes decrease in microtubule assembly, having poor mitosis, bago mamatay si parasite. In parasequental naman, ang ginagawa niya, you increase calcium influx. This time, yung ginagawa mo, pinapagod mo yung parasite, nagkakaspasm siya, causing its paralysis. And lastly, your parental pamuwit naman, ginagawa naman is sodium influx, causing depolarization-induced paralysis. 134. Which anti-asthmatic drug has the narrowest therapeutic index among the choices? It's theophylline. So, a narrow therapeutic index, okay, it's very important. Kasi if you have a narrow index, ang point niyan is prone ka for toxicity. Therefore, theophylline use mandates a closer monitoring of theophylline levels in the blood. Kasi it can cause cardiotoxicity, can cause arrhythmias, and even neuro problems. Kaya bantayan ng mga taong may theophylline as much as possible. 135. Which antiviral agent is or are indicated in patients with CMV retinitis that are having ganciclovir resistance. So guys, ang ating kasing CMV, the best drug for it is actually ganciclovir or valganciclovir. Siya ang best drug for CMV. Pero pag hindi siya gumagana, you may use actually your foscarnet and cidofovir. Automatic guys, ang ating acyclovir ay hindi gumagana sa CMV. Your CMV is resistant to acyclovir and valacyclovir. Kaya ang best drug of choice sa kanya ay ganciclovir. Pag di nito gumana, sa akong magagamitin si foscarnet and cidofovir. So, ginagamit yung dalawang din to kapag meron kang mga acyclovir-resistant na HSV. 136. Which receptor is not an opioid receptor? Okay? Phi receptor is not an opioid receptor. We only have mu, kappa, and delta receptor. All of them are analgesic drugs. Pero, only mu and kappa receptor activation can lead to slower GI motility. While delta don't have that kind of effect. Pero it can cause tolerance to opioid use if activated. Ang difference ng kappa kay mu, si kappa may sedation siya, si mu meron kang respiratory depression. So, iwas sa mu receptors. Baka ikaw magkaroon ng respiratory depression. Okay? 137. What drug is used as an antidote therapy for opioid analgesics? It's your naloxone. Okay? Anemonic ko dyan, naloxone ka. Okay? Nalason ka sa opioids. So that's the best antidote for it. And take note, antidotes are important testable concepts for pharma in IM and even in pedia. So you have to memorize these antidotes and for the respective poisons. A very testable concept for pharmacology. 138. Pharma is also involved in therapeutics. So which treatment modality is not effective for the improvement of mortality among COPD patients? A, B, and C can cause improvement in mortality. It's actually life-changing to remove the affective emphysematous lungs in patients na may COPD, to provide oxygen therapy for those with chronic hypoxemia, and of course, smoking cessation saves lives in general. But pulmonary rehab cannot affect mortality. it can only reduce the hospitalization of your COPD patients, according to Harrison's. 139, what are the main agents for Prince metal variant angina? Prince metal variant angina can cause transient ST elevations or depressions due to transient coronary vasospasms. So, it's a mimicker for MI actually. So, ang goal mo is hindi ka mag-coronary vasospasms. So, nagbibigay ka ng mga CCBs, check, which can limit vasospasms of the coronary arteries and nitrates to allow dilation of these coronary arteries. Pero take note that beta blockers and aspirins are not indicated for those with Prince metal variant angina. And in fact, aspirin can even increase severity of each episode of ischemia from this kind of angina. So, ingat sa paggamit nito. And last but not least for pharma, activation of this adrenoceptor causes increase in heart rate. That is your beta 1. Okay? So guys, dito of course, remember, you have one heart, beta 1, you have two lungs for beta 3. Okay? Alpha 1, smooth muscle contraction. Beta 2 can also cause your smooth muscle relaxation. Vasoconstriction, vasodilation ang ating beta 2. Take note of that. All beta 1, 2, and 3 can cause lipolysis, but the major is beta 3 for lipolysis. Alpha 2 causes decrease in sympathetic outflow, mimicking parasympathetic effects. While beta 1 is unique also kasi it can cause direct renin release, activating your RAAS metabolites. And that is all for your pharmacology. So you have to know, of course, the different receptors. Again, this time medyo advanced na quantity from physio. You have to know their G protein involvement and their salient functions across the body. Okay? Now, we head to surgery. Okay, for question 141, this organ is perhaps the most unforgiving organ in the human body, leading to most surgeons avoiding it to be palpated during surgery. It's the pancreas. So, meron general fear tayo for having pancreas palpation kasi it's very sensitive. Ang pancreas, baka mag-cause ng pancreatitis. So, iniwas talaga ng mga tao yan. So, according to Schwartz, it's the most unforgiving organ in the human body. 142. A patient after injury has tachycardia of 125, hypotension, and confusion. So, you have to know this table actually in Schwartz. If meron kong ganyang symptoms, tachycardia, hypotension, and confusion, you may have a blood loss of around 1.5 to 2 liters. Kasi, it's a class 3 hemorrhage already. So guys, the tables in Schwartz are very important, okay? They're infused naman in your handout in surgery. So don't be afraid, okay? 143. Which procedure has the highest expected infection rate? According to Schwartz, it's your colorectal surgery. Bakit? Well, let's discuss in a few. So there are 4 types of wound classes. Class 1 or clean, Class 2 clean contaminated, and Class 3 contaminated. And lastly, of course, Class 4 or dirty. Pag Class 1 ka, wala kang infection involved and wala kang hollow viscous na pinipenetrate. Okay? Pag Class 2 ka, merong nabuksan ang respiratory tract, alimentary or genitourinary, pero walang spillage of content. So, malinis tayo for that part. Ang tawag ay clean, pero contaminated ka. Pag ikaw ay class 3 or contaminated, these are involved in open accidental wounds, extensive production of bacteria in a normally sterile area. Example, nag-spill ang contents sa iyong peritoneum, which is normally sterile. Diba? Or an incision to inflamed non-purulent tissue. Ang class 4, ito yung mga overt na madumi, baseline. Imagine mo, there's delay in treatment, there's necrotic tissue, you incise a site with overt infection, and there's a high degree of contamination. These are automatic dirty wound classes after surgery. So, ang trend dyan ay, as you go with the wound classes, the higher the risk for infection rates. Which is true. Pero, may type of clean or contaminated na surgery, which is colorectal surgery, na mas mataas pa, even dirty. Therefore, per Schwartz, it has the highest expected infection rate. Okay, so ano siya? It's an add-man-out question. 144, in a pedia patient, you have eye opening that is spontaneous, irritable, and withdraws to pain. What is the GCS of the patient? It's actually an E4, V3, M4, 11. So guys, per Schwartz, iba ang adult sa ating children na GCS. So take note of this table for memorization. 145. Okay, a patient was brought to a burn center for management. Upon PE, there is actually bone charring of the humerus. Per Dupuytren classification, anong classification niya? Bone charring is seen in the 6th degree of burn. Okay? So, this is an old classification but can still be asked, okay, in legal med and even in Schwartz kasi it's still mentioned in Schwartz eh. Pag first degree or superficial burn, the other name for it, up to the epidermis lang. Pag partial thickness, up to the upper one of the dermis lang ang involved na burn. Pero pag full thickness ka or third degree, up to the whole dermis ka na. Pag soft tissue niya beneath the dermis na, ang tawag ay 4th degree already. Pag umabot sa muscle sa bone, 5th degree na siya. Pero pag ang bone mo ay nag-char na already, para naging pudpud na into ash, 6th degree burn na siya, according to Dupuytren classification. 146. Upon DRE, there were submucosal tissue cushions. Pero these are distal or below the dentate line. These are external hemorrhoids. Kasi automatic guys, if the lesion is actually proximal or above the dental line, dentate line guys dentate line, okay, ang tawag dyan ay internal hemorrhoids na. In general, internal hemorrhoids are insensate. So, painless sila unless nagkaroon ng thrombosis. Ang external hemorrhoids are actually more painful kasi the anal derm, distal to the dentate line, is actually consists of pain fibers. So, mas masakit siya. And take note that the degrees of hemorrhoids are only applicable to internal hemorrhoids. Okay, first degree can bulge into the anal canal but may prolapse beyond the dentate. Bulge lang siya. Pag second degree ka, they are actually reduced spontaneously. Third degree, kailangan ng manual reduction. And fourth degree, hindi mo siya mapasok sa loob kahit kaanong pasok sa loob ng iyong anal opening. 147, which is not part of renal pentad, it's actually vomiting. So, these are actually features of your acute cholangitis. The first three are actually your Charcot triad. Okay, in patients with acute cholangitis. But if you have complication of acute cholangitis leading to sepsis, okay, you can have a renal pentad, having shock and altered mental sensation on top of your Charcot triad. And vomiting is not part of this triad. So guys, please be aware of triads and pentads. They're very testable in the board exam. Okay? 148. A pressure injury has full thickness skin injury with destruction or necrosis of the muscle in the bone. What is the stage of this ulcer? It's stage 4 already. Take note that common sites of ulcers, are as follows. But the most common site is the ischial tuberosity, not the sacrum. Kasi mas doon mataas ang pressure kapag nakasupine ang ating pasyente. For staging, stage 1, non-blanching lang siya. Stage 2, may blister ka na or exposed dermis para pumutok ng blister. Pag stage 3 ka na, okay, meron ka ng full thickness injury but not including fascia and walang involved na adjacent tissue. Pero kapag meron ka ng destruction, necrosis of the muscle, bone, tendon, and joint capsule, stage 4 na siya automatically. Take note that in surgery, ortho questions may be asked. So a fracture involving, an epiphyseal fracture of pedia patient involving the metaphysis, physis, and epiphysis, that is a type 4 Salter-Harris classification. Kasi it went through the growth plate. Okay? It affected the epiphysis, the growth plate, and the metaphysis. So, nasira siya through the growth plate. Pag type 1 ka, na-separate lang ang ating growth plate. So, okay pa siya, relatively. Pag ang problema ay above the growth plate, like this one, type 2 lang siya. Pag below the growth plate, L, below L, doon lang siya involve. Type 3 lang siya. Pag true and true ka, that's type 4 already. Pag nawala ang ating growth plate due to compression, ang tawag dyan ay type 5 na Salter-Harris classification of your epiphyseal fracture. Okay, take note of fracture classifications, type of fractures for surgery. 150. A patient having right upper quadrant pain, a palpable mass, and jaundice. These are tried for choledochal cyst. And obviously, sa imaging mo, may nakita ka ngang cystic structure na saccular ang kanyang presentation. That is a form of type 2 choledochal cyst. Kasi you have actually 5 types. Yung form mo may A and B. Pag 1, fusiform siya. Fusiform siya. O for 1. Pag saccular siya, type 2 dyan. Okay? Pag nasa duodenal siya, malapit sa duodenal area, that's type 3. Pag may mga multiple cysts ka na, like for example, as you can see here, both A and B has extrahepatic involvement. Pero ang 4A mo, it involves both extrahepatic and intrahepatic. 4A na siya. Pag only intrahepatic ang involved, ang tawag dyan ay type 5 or Caroli disease. Pareho lang sila. 151. What is the most probable agent causing your type 3 neck fash? That is your Vibrio vulnificus. Okay, there are actually 3 types. Type 1, 2, and 3. Type 1 from a polymicrobial source can contain gram-positive cocci, rods, or anaerobic bacteria. Pag type 2, mas monomicrobial siya. So, pwedeng GABC or MRSA. Pero pag type 3, usually involve in exposure to body of seawater, think of Vibrio vulnificus. And true enough, guys, I've seen 2 cases already. One in PGH, one in St. Luke's. In PGH, when I was an intern, pasyente na natusok habang kumakain ng isda. Nangyari, meron siyang Vibrio vulnificus infection. Namatay siya after. Sa St. Luke's naman, natusok siya habang nanghihimay ng shrimp. Okay? So, meron ding Vibrio vulnificus sa kanyang lesion na neck fash. Namatay rin si patient. So, seawater involvement, guys, tas nagka-trauma ka, think of a possible neck fash. Although, in my experiences, walang seawater exposure. Exposure lang sa pagkain sa dagat. So, it still can be a risk factor, probably. Okay? Pero by definition, in Schwartz, kailangan exposure to seawater. You have Vibrio vulnificus. 152. You have epigastric pain. Tapos, nagpa-ERCP ka, may nakita kang mucin extruding the ampulla of water. So, it's like a fish eye lesion, usually seen in IPMN. So, this is actually a rare pathognomonic sign of a pancreatic mass known as your IPMN. Okay? So guys, the pathognomonic signs, clinical signs, those are testable in the board exams. 153. What is the most common neck zone involved in penetrating neck trauma? It's your zone 2. Zone 2, guys, is found between the cricoid cartilage and the angle of mandible. Okay. Tapos it goes downwards. Okay? So, yan ang ating involvement. The cricoid here and the angle of the mandible here. It's the most commonly involved zone. Obviously, siya yung pinakagitna, siya yung madaling tamaan in neck trauma. Now, ang pinakamahirap ma-intervene dyan is the zone 1 kasi it involves the neck downwards. Okay, so mas mahirap siya magkaroon ng intervention pag zone 1 pababa. 154, which is not a risk factor for retained surgical sponges. A is a risk factor. If nagmamadali ka in surgery, baka may makalimutan na sponge. So, delikado yan. Involvement of too many people. Okay? 3 sa crowd. The more people involved, the more na hassle. Baka hindi na bilang properly ang sponges. So, risk factor siya. And of course, kapag dumaan ng tagal ng surgery, mabot ng endorsements ng mga nurses. Diba? Baka hindi ma-endorse ng nurse. Ang dami ng surgical sponge. Baka may ma-retain and can cause abscess formation after. So, there's a risk factors. And of course, if a patient with a high BMI, dahil for example, maraming fat sa visceral area, di ba? Baka matakpan, hindi makita, meron pala naiiwan na sponges. So, dito, having a low BMI poses a low risk factor for surgical sponge retainment. 155. The best described dump involved in SIRS from post-trauma is no other than your high mobility group protein B1. So, dumps are actually markers for inflammation. They actually activate your systemic inflammatory response syndrome. Now, ang theory dyan, hindi lang pala siya bacteria na pwede mag-cause. Hindi lang pala infection. Pwede rin pala ang trauma. And this is being done by your HMGB1. 156, which is not an indication for referral to a burn center, it's letter D. Having chemical burns is an indication. Electrical injury, either simple lang yan or lightning injury is an indication. Pero kapag ang partial thickness burn mo ay only 3%, hindi siya kasama. Kailangan at least 10% ka na TBSA involvement bago ka may indication for referral to a burn center. Pero pag third degree or full thickness, parati kang kailangan may refer sa burn center regardless of the TBSA involved. Okay, the rest are the different indications. Face involvement, hands and feet, genitalia, perineum, and the major joints. If you have a problem medically, and sa mga pasyente na walang babantay sa kanila after, like children and the socially impaired people. 157. What is the best tool for evaluating the depth of invasion of neoplasms of the rectum? It's your ultrasound. Kasi, ang mangyari dyan, kaya mong malaman if gaano nakalalim yung invasion ng ating neoplasm across the GI wall bago siya lumipat sa mga lymph nodes natin. So, siya ang best tool na ginagamit. Angiography is used for active intestinal bleeding. CT scan can only detect extraluminal lesions. Totoo yan. I've seen a patient in my residency training. Sa CT scan, wala nakitang mass. Pero nung endoscopy siya, may nakitang mass pa rin. So, poor actually yung CT scan of the abdomen to know intraluminal lesions. It can only be useful in extraluminal lesions of the GI tract. And of course, pwede mo siya magamit for staging if may mga mets ka makikita. MRI can also be used in staging, pero mas CT scan ang ginagamit natin. Pero ang MRI, according to Schwartz, ang value niya is for pelvic lesion evaluation. Okay, this is important kasi depth of invasion is the single most important predictor of lymph node spread of colorectal cancer. 158, which is not a parameter used in Blatchford scoring. It's actually age. SBP, BUN, hemoglobin are part of Blatchford scoring. Dito guys, I'm not requiring you to memorize them per part. Kailangan alam mo lang yung mga involved here dito na mga parameters. Take note that the Rocal score has age as part of its re-stratification. Okay, the Blatchford and the Rocal score for upper GI bleeding. 159, the best to detect blindness, color blindness rather, is your Ishihara testing. Leia charts are for testing visual acuity for children, starting at age 3. Snellen chart, of course, the basic for your participative children and adults for visual acuity. And pinhole is used for detecting errors of refraction. And lastly, guys, very important in surgery, in IM Impedia and in OB, of course, you have to know the contents of your IV fluid. Hindi pwedeng bigay ka lang bigay ng fluid without knowing the rationale for it. Okay? Among them, the only one containing bicarbonate ions is your LR. Kaya maganda siya bigay in patients with infection. Kasi if in infection, you have what you call lactic acidosis, right? Especially in states of sepsis. So, bumababa ang level ng iyong bicarbonate ions in the blood. Kasi lactic acidosis is a form of metabolic acidosis. So, nare-replenish ng konti ng ating LR ang ating bicarbonates in states of sepsis. Kaya usually, binibigay siya sa mga infection, ganyan, and even in acute pancreatitis. So, that is the best IVF for that in those cases. Okay? So guys, take note only LR has potassium, bicarbonate, calcium, and yung iba, wala. Okay? D5 water, wala siya, of course. It's only water. Sodium chloride tsaka chloride lang talaga yan. So take note of this basic knowledge for parenteral administration. They can be asked in the board exams. And that is all for your surgery.